You can be the strongest nurse on the unit, the one who never cries at work, who always shows up, who always says, "I'm fine." But here's the truth. We are not meant to carry this much stress, this much grief, this much pressure alone. Whether it's burnout, compassion fatigue, anxiety, or just feeling numb after a string of back-to-back shifts, mental health support is essential, and Rula makes it possible. That's RULA. Rula is a mental health care platform that connects you with licensed therapists, real professionals in network with your insurance, and they help you get started fast. They accept most major insurance plans, and sessions can be as little as $15. Depending on your benefits, you might even pay nothing. Rula doesn't just match you with a therapist, they stick with you. They make sure you're making progress and that you're getting care from someone who truly fits your needs. Thousands have already trusted Rula to support them on their journey toward improved mental health and overall well-being. Head on over to rula.com/nursemo to get started today. After you sign up, they ask you where you heard about them. Please support the show and tell them that this show sent you. Go to rula.com/nursemo and take the first step towards better mental health today. You deserve quality care from someone who cares. Let's be honest, your shift starts before you even step foot on the unit, and what you wear can really set the tone for the entire day, and that is why I love FIGS. Back in nursing school, I wore those standard boxy scrubs that felt like a scratchy paper bag, but not anymore. FIGS are so much better. They're flattering, they're super comfortable, and they're designed for people who actually work in healthcare. Plus, they're antimicrobial to help keep you protected. They're durable enough for endless washes and stylish enough that you actually want to wear them. If you're new to FIGS, I recommend starting with the Catarina top and the Cade pants. The Catarina has a relaxed, easy fit that's perfect for moving through a shift, and the Cade's cargo pockets keep all your go-to supplies within reach. You can get 15% off your first order at wearfigs.com with the code FIGSRX at checkout. That's wearfigs.com, code FIGSRX for 15% off. Hey there, Nurse Mo here, and I have got an encore episode for you as a special extra bonus. And in this episode, I'm joined by my nurse bestie and amazing nurse educator, Stephanie Griffeth, and together we're talking about the number one mistake that new grad nurses make and what you should do instead. And spoiler alert, it's probably not what you think. Now, you'll hear us mention Confident Nurse Academy in this conversation. This episode aired back when we originally launched the Academy, and since then we have completely revamped and reimagined and upgraded the program into something I am so proud of. Confident Nurse Academy 2.0 officially launches November 8th, and it's better than ever. Now approved for CE credit and redesigned with evidence-based tools, downloadable cheat sheets, and our brand new Shift Strategy workshop that helps you plan, pace, and personalize your shift like a pro. We created Confident Nurse Academy to help you bridge the gap between what you learned in school and what it actually takes to thrive at the bedside. Whether you're brand new or just ready to feel more confident on the floor, you'll find something inside that will change things for you, starting with your very next shift. Plus, we now have 3 tiers. We have a solo tier, that's like the self-paced, self-study version. Then we have squad. You get the lessons. You also get live coaching and guided support for a year. And then the 3rd tier is called boot camp. This is for the nurse who wants to fast track their confidence and walk away feeling absolutely ready to run their next shift without any of that pesky second guessing. So that boot camp tier includes everything that you would get in the other tiers, plus a live 2-day workshop designed to turn theory into practice. And up until November 7th, you can get boot camp at a significant discount, basically for the price of squad. And that way you get just a great deal and that confidence that you need to really just fast track your growth. You can actually preview a lesson inside Confident Nurse Academy, and it's a lesson on confident code blue response, one of our most popular lessons. And you can check that out at confidentnurseacademy.com/code blue. And again, right now, you can get into Confident Nurse Academy 2.0 at a great discount, $250 off the boot camp price. So you can check that out at confidentnurseacademy.com. And to take a sneak peek at that Code Blue lesson, go to confidentnurseacademy.com/code blue. Now let's get into this episode. I'm really excited about this episode today. It's a bonus episode, and I'm bringing on somebody that I think you're really going to love hearing from. Her name is Stephanie. She's my nurse bestie, and we're going to be diving into a really important concept that you won't want to miss, especially if you're a new grad nurse or soon-to-be new grad nurse. So Steph and I actually teamed up together to create a new grad Q&A guide that we would love for you to get your hands on. So if you're a soon to be graduating nurse or you've just graduated and you're starting practice, you definitely want to check this out. So go to straightanursingstudent.com/guide. That's straightanursingstudent.com/guide to get your free downloadable new grad nurse Q&A guide. Now, Steph and I were so excited about this episode that we agreed to go ahead and record it, even though she's on vacation and doesn't have her usual mic and that whole setup. So the sound level might be a little bit off, but I checked it and you can absolutely hear everything that she's saying. So I didn't want you guys to have to wait for this. It's so good. So let's dive in to Talking with Nurse Steph. I'm here today with Stephanie Griffeth, my nurse bestie, and I'm super excited that she's here with us today. And you may remember a couple episodes back, maybe 2, maybe 3 episodes back, I alluded to this concept of a growth mindset in the episode where I talked about 5 ways you can set yourself up for new grad success. And that was kind of a little teaser one at the end that I said I would talk about in more detail. So here we are talking about it in more detail with Steph. And I'm just going to first have Steph say hello, tell you a tiny bit about who she is. She's amazing, by the way. And then we will get into it. So Steph, tell us real quick who you are and your purpose in life. No, just tell us who you are, what you do, and all of that.
Hi, everyone. I am Stephanie Griffith. I'm a nursing professor in Northern California. I teach in a university nursing program. I've been a nurse for 13 years. I actually met Nurse Mo years ago in the ICU, and she is absolutely incredible. I also am a medical science liaison. I work in the critical care division for a company working on hemodynamics and fluid management and sepsis. So I love research and education. And my primary passion is really helping nursing students and new grad nurses really thrive. I think in nursing, we need a lot of support that can help us just overcome the learning curve challenges faster. And that's really why I'm here with Nurse Mo. So we're excited today to talk to you a little bit about the number one mistake new grads make, and it's not actually what you think.
So if somebody told me, what do you think that, or asked me that, I would probably say making a med error or, not notifying a doc about a change in condition or something like that. So you're saying that's not actually the number one mistake.
Correct. Yes.
Okay.
So those are things that we want to avoid, but we also know that those mistakes are unavoidable, and that's okay. It's not the mistake that we make, it's actually how we deal with it. And the number one mistake that new grads make is having something called a fixed mindset. So if you want, I can dive right into kind of explaining that concept.
Would love that. Yeah. What is a fixed mindset?
All right. Well, there are only 2 types of people in the world, according to Carol Dweck, who is a Stanford research professor. She's a psychologist. She's a TED Talk speaker. She's also an author. She wrote the book called Mindset, and she explains that there are 2 types of people in the world, and we can apply this to nursing as well. So there are fixed mindset people and there are growth mindset people. So having a fixed mindset is the single greatest mistake that new grads can make. And it really can determine how difficult new grad life will be for you, because ultimately a fixed mindset is about how you perceive yourself and the way that you handle obstacles, challenges, and mistakes. So being a new grad nurse, you know without a doubt that you're going to encounter obstacles. You know that you are going to make mistakes. You know that you're going to, I mean, you're already in a challenging profession, but right now the current landscape of nursing post COVID is exceptionally challenging. So the good news is that you can change your mindset with some certain tools, but you have to first be aware of what a fixed mindset looks like, what a growth mindset looks like, and then sort of how to move yourself along the continuum over to a growth mindset.
Okay. Can you give us an example of what a fixed mindset might look like or sound like or feel like?
Yes, absolutely. So people who have a fixed mindset paradigm believe essentially that people are born with a set amount of intelligence, a set amount of capability and skills. So in other words, they believe people are either, naturally good at math or not, or naturally adept at being athletic or not, right? People with a fixed mindset also believe that their worth is tied to their performance. So as a result, they're always trying to prove themselves. And then as a result of that, they perceive any mistake that they make as an utter failure. And so they tend to have very poor coping mechanisms in life as a result. Because if you think about it, if your intelligence and your capability is fixed, and then that person, and they believe that, and then they make a mistake, then they're going to jump to the belief that they're not actually very intelligent. That's
Right.
kind of the connection, right?
And that's a big blow to your self-esteem and your whole vision of yourself, especially in a challenging environment like being a new grad nurse.
Exactly. This also is the really critical piece that I think as educators we can identify with, and as nurses. This fixed mindset makes getting feedback, unless it's positive, very, very difficult for them. So negative or constructive feedback can utterly derail them because they believe if they didn't do something right and perfect the first time, they're a failure. So the issue I take with that is that feedback is one of the most powerful teaching tools that we have. We also know that, and I don't say practice makes perfect. I say practice makes better because
I like that. Yeah.
We're never going to be perfect. But imagine not being able to receive feedback at all. Imagine making it mean something about you. Imagine allowing all of your mistakes to define you instead of just teach you something. You can imagine this really puts you in a pretty negative frame of mind most of the time.
I would imagine just super stressful because, I mean, just nursing school alone, think about how often you get feedback in nursing school. It's like constantly, right? You have exams, you have projects, assignments, papers, someone watching your every move in skills lab, every move in clinical, and you're constantly getting feedback. And a good portion of it is probably, growth feedback, right? And that's really hard for some people to hear. And then when you actually start working as a nurse, holy cow, it just gets intensified.
It really does. And it's actually important that someone with experience can give you that feedback. And yes, there is a better way to deliver feedback than others, and that's a different conversation. But the idea is that if you're threatened by any feedback, instead of seeing it as a gift, you perceive that if you make a mistake, it becomes part of your identity and you're a failure, it is going to make your professional life, well, your life as a student and then your life as a new grad, especially, extremely difficult. It is a process. There is a continuum of growth in our lives, especially in nursing. And so if you only value that end result and you place that really heavy expectation on you that you have to do something right the very first time, then that the pressure is also to perform is also going to become an issue for you. So that fixed mindset is very, very rigid.
So I guess my next question would be then, Steph, is what does this look like in someone? I imagine they would have a lot of anxiety around their job and the other things that would show up that might help someone notice if they have a fixed mindset or are heading down that path, or just kind of the dangers of it.
Yeah, it's a great question, Nurse Mo. I think as a student, I see it as hypervigilance, anxiety, triple checking, quadruple checking, and then that bleeds over into new grad life as well, with a lot of anxiety, being and acting very high strung, not allowing there to be any gray area, and then allowing that fear of failure move into fear of looking bad in front of your coworkers. And so how that manifests is you're afraid to ask questions because you don't want to look stupid. And usually it's actually not ego protective in most of the new grads I've worked with. They feel like they should know because they put this intense amount of pressure on themselves. And so if they feel like they should know something, which we learn things every day. We've been nurses for a long time and we still learn new things every day. That's also part of evolving with evidence-based practice and different things. You're going to continuously get that new information. So if you're afraid to ask a question because you think you should know something, then that's a problem because we want you to learn. We also need you to speak up if you don't know something, right?
Yes.
And then I think additionally, there's just a constant negative self-talk narrative, and then they go into shame. And then the new grads that I work with feel just overwhelmed that they can't get something right. And they feel like that, no matter how hard they try, they're not going to get it, which actually isn't true.
Not true at all, by the way.
Not true at all. No. We all had to practice our IV starts. We all had to practice our time management. We've all had to practice, insert whatever kind of skill it is. So we all had to practice. None of us started perfect out of the gate.
Absolutely. So, okay. So a fixed mindset, let me just summarize to make sure I get it, is kind of a belief that you're either inherently good at something or inherently not. And if you're inherently not, no matter how much you practice, you're just not ever going to be great at it, which would lead you to avoid trying new things, avoid getting out of your comfort zone, avoid growing, avoid asking questions. Am I picking it up?
Yes, exactly.
Okay. And those are all not good things because as a new nurse, you're constantly growing every single day. I would say almost every single hour, you're doing something brand new.
Exactly.
And patient safety 100% relies on your ability to recognize your knowledge gaps and seek to fill them proactively.
Yes, exactly.
Okay. So that's fixed mindset. And as you were saying that, I'm like, oh, I've been guilty of that a lot. And not so much now, but when I was a student and when I was just starting out, 100%. Like,
oh, yeah.
So much of that hyper, triple checking. So much of that, I don't want to look like an idiot in front of anybody.
Yes. Yes,
so
absolutely.
I know.
And I think once you do gain some competence and I notice it in myself, if I know the right thing to do and I'm still questioning myself and I want to crowdsource and ask 3 more nurses before I just do the thing, I've noticed that is also a problem, right? Because I'm being too hyper vigilant. And there does come a point in our clinical practice where we need to trust ourselves and trust that we know what we're doing. And that comes with time. I mean, it's good to be cautious, but it's not good to be, paranoid. And that's, I think,
or paralyzed, right? Paralyzed with fear.
Yes. And that's happened to me too. The good news is that we can, with self-awareness and self-reflection, we actually can move ourselves with some tools toward more of a growth mindset. And this, by the way, is a critical skill for nursing students and nurses to have, but this applies to people in all professions. This is not just exclusive to nursing. Having a fixed mindset will limit you in life, no matter what you do for a living.
Okay. Very good to know. You could apply it just to your personal life.
Yes.
Like I always say, I'm not a runner. I could be, I guess, if I wanted to be. 100% could be a person who runs. But instead, I have this mindset about, nope, not a runner. 100% not going to happen.
That's so interesting. There was a study, they've studied a lot this idea of nature versus nurture, or do genetics actually play more of a role than we thought in your health? And it turns out that they play less of a role than we thought, that it's actually our choices that go into our physical health more than anything. Yes, you might be able to have a predisposition for something, but it's actually our choices that put us into a place where we're either maybe considered healthy or less healthy.
So choosing to hang out and watch Murder, She Wrote is the opposite of going for a run, is what you're saying.
Everything in moderation.
Okay. All right. So you talked about some tools that people could use to kind of shift their mindset from that fixed mindset. And then what's the opposite mindset we're talking about?
We are talking about a growth mindset.
Okay.
All right. So the first thing that we can do to really embrace a growth mindset, obviously, the first step is just awareness of, hey, yeah, I tend to be hypercritical of myself and internalize my failures and think of them as failures instead of lessons, that kind of a thing. So the first thing that you can do is separate your performance from your identity. So you are not what you do. I know it's very easy for nurses to say, "Oh, I'm a nurse," and we have these very common characteristics and traits of being empathetic people, compassionate, helpers, all of these things. But it's important that you understand that you are not your test scores.
I say that all the time.
Yeah,
all the time.
Yes, you are not your knowledge of cardiogenic shock. You're not your knowledge of the ACLS code algorithm. Like you have to separate who you are really from what you do. That is really, really core. You are a human being. You are loved. You are worthy. And whether or not you are wearing jeans or scrubs, you matter. And so knowing that you're not what you do, although we love nursing, and I think nurses are the most special people on the planet, I really do. We have to really separate our personhood from the professional role of nursing so that we have a boundary there and we don't get derailed as aggressively, if something goes sideways at work, which it will. It's nursing.
Oh, yeah. It will go sideways. So separate your identity from your performance. You are not your knowledge base. You are not how well you place that IV. You are an actual complex human being who's so much more than that, is what you're saying.
Yes, exactly.
Okay.
Yes.
Okay, that was number one. One little step. What else you got?
Keep things in context. So this can be really hard.
Yes, because even small things become a big deal when we let them take on that huge meaning in our minds.
Yes, what you focus on expands. This is just a normal universal principle. So if we keep things in context, then one of the things that we can learn from growth mindset people is that they tend to bounce back from adversity or bad days very quickly. They have better coping skills in the moment when a challenge arises because they're keeping things in context. So if they have a bad day or a bad shift, it's just a bad day or a bad shift. It's not a bad life. It's not that it's if we don't arrest sort of those negative thoughts, suddenly it's, oh my gosh, I can't believe I'm a nurse. I'm going to quit. I need to go work in a cupcake shop, which would be my dream actually.
That sounds lovely.
It really does, right? But if they make a mistake, they learn from it and they're not internalizing the mistake with the negative self-talk of, I'm never going to get past this, or I'm a loser, or I'm an idiot. Those every time you have a thought, it produces a chemical in your body. And so we really want to be, I'm not saying you're going to have 100%. There's a difference between toxic positivity, right?
Right.
And overriding the reality of the situation. I'm not saying don't live in reality, but it's ruminating on things and then going down that path of negative self-talk instead of keeping things in context is the difference between a fixed mindset person and a growth mindset person.
Yeah, I like that you mentioned you don't want to be like toxically positive, because I think when people first hear, someone talking about negative self-talk and stopping negative self-talk, they might automatically think to go so far on the opposite direction that it becomes toxically positive and not even true.
Correct.
So when I'm talking to students about their negative self-talk, I say you can't just replace it with the opposite statement. Your body, your brain, your soul is not going to believe that. But you have to replace it with a true statement that's actually real. Like I had a student who would say, I'm bad at math. I'm not a math person. I'm bad at math. And so we talked about it and I said, you can't just start saying I'm great at math because maybe you're not yet. And no, you're not going to believe that in your core. So she developed a statement that says, I know math is hard, but I'm practicing and getting better every day. And that was how she reframed that. And she had phenomenal results from just that small mindset shift.
I love that. Yes. One of the core characteristics of a growth mindset person is they say, I don't know how to do that yet. So instead of just saying, I don't know how to do that, you can just say, I don't know how to do that yet.
And then you're open.
Really powerful.
You're open to learning and taking on something new and facing a challenge and getting out of your comfort zone and doing all those things that we do when we show up for work.
Yes, which actually brings us to our third thing. So growth mindset people also approach challenges with a lot of excitement because they know that no matter what, come what may, however it goes, they're about to learn something, which is really exciting because individuals with a growth mindset are not confused about the learning process. They know that it's going to be hard. And so they actually embrace the learning, they embrace the unavoidable reality that they're not going to be an expert yet. And they know that with time and with practice and commitment and just consistency, by the way, will beat intensity every time. If you're, yes, if you're consistent with something, that's a lot different than doing one thing really well once, right? So this is just the really exciting part, is to see challenges as exciting opportunities to learn something new, and then to obviously give yourself time to grow into that. You have to have realistic expectations. You're not going to have the skill set of a 10-year nurse when you've just passed your NCLEX.
Right. What is it? The saying, don't compare your beginning to someone else's middle.
Exactly.
Like that's just setting yourself up for a really big disappointment and horrible day.
It is. And it's also not living in reality. Like, you are not late. You are right on time. And if you make a mistake, you're not a failure. I am a failure that language is very different than, oh, well, I'm going to keep this in context and say, just for an example, to make it really real, I'm going to keep it in context and say, gosh, I have never done that procedure before, or I've never prepped a patient for a liver biopsy. And, I missed a step or two. I didn't realize these couple of things. I'm going to go ahead and make note of it. And then next time I will, I'm going to write myself a reminder, and I'm going to go ahead and do it better next time.
Yeah. I love that. And I make mistakes all the time. The only way I do my life is to mess something up first, and then I come back and fix it the second time. Exactly. And it's really valuable learning for me if it was a super expensive mistake.
Yeah.
That's the best kind to make.
I do this actually a lot in cooking because it takes me 2 or 3 tries. I have all these Pinterest picture fails, and it's hilarious because I need a couple of times to make something before it's actually even remotely going to turn out. Usually I'm talking about baking, and you have almost every cake I've ever made falls apart, but I'm getting better.
That's right. You're not an excellent cake baker yet.
Correct.
But you will be, and I will be having some of that cake.
That's right.
Okay, so I just want to recap real quick so people don't lose their place. Number 1, separate your performance from your identity, which takes a lot of self-awareness, and I think a little bit of courage too. Mm-hmm. But with practice, I think it would get easier over time, just like anything. And then number 2 was to keep things in context. Mm-hmm. Yes, maybe you didn't excel at this one thing, but the world didn't stop spinning, and you're not a horrible person, and you shouldn't leave nursing. Keep things in context.
Yes.
And number 3 was approach your challenges with excitement because you're about to learn something. And I want to add just a little thing onto the end of that is when I get super excited about learning something new in my job, the learning part is exciting, but then I get really jazzed to apply it. Like, I'm going to use this technique the next time I have a patient with really hard to find veins, or I'm going to use this strategy when I'm having a really hard time comforting a patient who's in a lot of pain or whatever. I just get excited about using the new knowledge that I have. And then you really see if it works or not. And sometimes it doesn't, and you have to keep trying.
And then that's why I love nursing, because it's so collaborative. I might have one specific approach, but then if I see you do something and you might have a shortcut, a workaround, or even just a better approach in general to something. And that's why it's so exciting, because you're always going to be learning in nursing. We call that being a lifelong learner.
Absolutely. And it's one of the coolest things about our job.
Yeah, you'll 100%. Never get bored. Never get bored.
You will not get bored. Absolutely. Absolutely not get bored. Okay. Anything else you want to add about growth mindset, fixed mindset, how that applies to a new grad nurse? Did we cover all the main things, Steph?
I think we covered a lot of the main things. Like you said, it starts with self-awareness, which takes a lot of courage because you have to be willing to look at yourself. And I would just say, be gentle with yourself. None of us, there's a quote from this life coach, and he says, it took me 20 years to become an overnight success.
Oh, yeah.
And
I've heard that before.
yes. And so there's no such thing as an overnight success. There's really not. And what we have to remember is just if we consistently begin to apply growth mindset principles, we will gradually lean into those principles and become a person with a growth mindset.
I love it. I love it. And as a new nurse, it's really easy to look at yourself and think, and at the same time, look at the awesome nurses you're working with and think, oh my gosh, how does Patty, she just looks so together all the time. And I'm over here a hot mess, and she gets all of her charting done and still has time to chat with her patients. Like, how does Patty do it? But you're comparing your beginning to someone who's been doing this for 20 years. So stop. I would say that's the number one thing I want you to do if you're doing this. Just stop doing that. Take things into context, like Steph said, and reframe that negative self-talk and say, I'm not where Patty is yet.
Exactly.
Right?
Yeah.
I'm not there yet.
And hopefully Patty has some good tips.
Yeah. And hopefully Patty has some good tips to share and loves teaching. And you'll be the Patty in no time at all. Thank you so much, Steph, for coming on the podcast today. It's been super great. I know people just are going to love hearing from you just as much as I do. And then we'll be talking again, I believe next week, about nurse shock.
That's right.
Which is a really interesting kind of framework that you developed that I cannot wait to dive into with you. So if you are not yet subscribed to the podcast, make sure you follow the podcast because this is a bonus episode. It will not come out on the regular Thursday, so I don't want you to miss it. So thanks again to Nurse Steph, and we'll be chatting with her again soon.
Thanks, Mo.
So there you have it. Some really great insight from Nurse Steph about growth mindset versus fixed mindset. Some of that resonated so deeply with me, and I really hope that it did for you as well. So again, if you are starting your career soon, maybe you're graduating soon, or you've just graduated and you're looking for some extra guidance, then definitely go and check out the new grad Q&A guide that I mentioned at the beginning of the episode. That is at straightanursingstudent.com/guide. So I will see you back here next week. We're going to do another bonus episode with Nurse Steph. I got a little sneak peek into what she's going to be sharing with you, and it is so, so good. So I'll see you back here next week for that. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Doug. Here we have the Limu Emu in its natural habitat, helping people customize their car insurance and save hundreds with Liberty Mutual. Fascinating. It's accompanied by his natural ally, Doug.
Limu, is that guy with the binoculars watching us?
Cut the camera. They see us.
Only pay for what you need at libertymutual.com.
Liberty, 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 liberty.
Savings vary. Underwritten by Liberty Mutual Insurance Company and affiliates. Excludes Massachusetts.